Good morning, everyone, and I welcome you all for the first FB live session from EldersIndia. India is home to about 138 million elders today, roughly 1 in every 10. By 2050, when a considerable number of current working population would have become senior citizens, this will become 1 in every 5. Yes, 20% of our population by 2050. So given this rapid increase in the population of senior citizens, it's a very relevant question to ask, can we improve our overall well-being as we age so that we remain active, independent, and healthy for as long as we live? If this is possible, what can we do from our own perspective? If you are not elders today already, we'll get there sooner or later. Or from the perspective of a caregiver, if you have children or grandchildren caring for the elders at home. So this is a very broad, but very important and interesting topic. Answering all our questions today and giving an expert perspective is Dr. Prem, Consultant Geriatric Medicine at Jeslock Hospital, Mumbai. We are privileged to have you with us, Dr. Prem, and welcome to this FB Live
Thank
session.
you. Yeah, it's great to be back again.
Thank you so much. Dr. Prem, I have a few questions to begin with. And as we progress, we might have a few questions from the audience as well. You are a geriatrician, and there are not too many geriatricians in India. And so I want to begin by asking you this. Among all the specializations that we have in the field of medicine, what does a geriatrician do? And typically, when does someone consult a geriatrician versus any other specialist?
Yeah, of course, as such, geriatrics and elder care is very close to my heart. And we have to understand that when there was obviously a talk about pediatrics coming as a specialty, before that, it was only, to be very frank, people in medicine and general practitioners used to actually see children as well.
Mm-hmm.
So they realized that children needed that specialized care. So even, I mean, to be very frank, even in the West, it took quite a bit of time. I mean, in 1909 was the first time the word geriatrics was coined by Ignaz Leo Nasher. So he was like, when there is a specialized care for children, then there should be a specialized care for older adults. Why? Because they have specific needs, they have specific problems, and one has to always keep into perspective aging as well. You can't just treat them as just any other adult. And the word geriatrics, of course, means geros and from itrikos. So it is a breakdown. So geros means old age, and itrikos means healer. So that's how the geriatrics word itself came up. Now, why does a person need a geriatrician? Who is a geriatrician? When? So, I mean, just before going into that, overall in the world, 65 is usually taken as the cutoff. But in India, of course, with retirement age, 60 has sort of been taken. So usually there is a different categories: young, old, middle, old. So usually 60 to 65, and 65 to 74, and of course more than 75 records. So we are expecting this to be pushed even further. So now, as you quoted that statistic, it is only going to get increased. So we need more geriatricians. Why? Now, what a geriatrician, first of all, is already been trained in specifically taking care of not only the problems of older adults, that is the diseases, but also keeping in mind their age-related problems and also their treatment preferences. So now that is something which would never come in a pediatrics kind of a subgroup, because treatment decisions, the older adult, this is a mature adult who has to be taken into the consideration also. For example, an older adult, any patient can refuse treatment, but an older adult can obviously have their own thought process, and that always is always to be sort of looked at. Now, what a geriatrician does is he or she provides a holistic care for an older. As I mean, we had even talked last time as how health is a state of physical, mental, and social well-being. So the holistic, comprehensive, holistic care for older adults is what a geriatrician sort of provides. Now, when should you see? According to me, anybody above 60 should anyway see a geriatrician, because you need to know your baseline as to where you are in your aging process. Fine, if you don't have any problems, we don't discuss anything, that is great. But geriatrics is not only about your current problems, it is about planning for your future. So it is more of a life course wherein a continuum of care can be taken care of. So that's why the geriatricians are sort of different from maybe the other sort of doctors.
I got that. But just to kind of understand this a little more, what happens at old age that need some special attention?
Yeah, so I mean, to be very frank, what I have learned is all from my patients, and see, one has to understand that even WHO is putting so much of emphasis on it, and in fact, this was supposed to be the decade of healthy aging, 2020 to 2030. So we lost, I wouldn't say, usually people would say lost 2 years in the pandemic almost, but no, we actually thought about elder care a bit more. So there was a lot of thought process on how to reach a wider area of older people. So I think that also helped. Now we have to understand that in older adults, health is not only the disease. So what happens in older adults? One is there is something within them. So by within, I mean, one of the very important things that happens is their disease process per se. If they have a single disease, that's okay. If they have sort of multiple diseases, then it can be quite difficult to sort of handle. Then another thing that might actually sort of happen is the number of drugs. So sometimes what happens if the person has multiple amount of drugs, then that might actually be an issue.
Actually, but it's 11 o'clock.
I think you'll have to just mute that. I think.
Oh.
Vinod, can we please mute that, please?
Yeah. So as I said, what is also important with older adults as such going through them is a lot of intrinsic factors. Now, aging itself is very important. So now as we always say, we talk about a car. A car, obviously, as it gets older, as I mentioned last time also, we need to keep changing things. So if it's a knee which is of 80 years old, then obviously it has worked for 80 years from the time we have actually stood up on our feet. So aging changes is always to be considered. I mean, and nobody can sort of run away from it. We cannot say that no. I mean, you can age well, but that doesn't mean that you're not aging. As I said, 1 year old means you are 1 year old. So you're 80 years old means you're 80 years old. Then things which really matter is what you do during your, I mean, how do you experience old age is also depend on how you have experienced life in general. What is the diet you have taken? What is your lifestyle which has happened? What is whether you have been exercising or not? Whether you have been doing extracurricular activities, good or bad, both. I mean, by good ones, of course, if you have a healthy diet, if you have a lot of social connections, if you are very active in all aspects. But bad, the amount of alcohol you take, have you been smoking? Are you taking less amount of water? Do you eat a lot of junk food? Of course, this applies maybe to all the latter generations much more than the earlier generations, but it matters. Then another very, very important thing is to experience a good old age, you have to understand it from a younger age. Now you work towards your old age. Nobody just gets old suddenly. Now, family history also matters a lot. For example, if somebody has a lot of disease processes in their family, so one has to understand that might be a big risk factor. So you have to understand, you have to get your checkups done. So you should not just neglect this, or just because 2 people had it in the family doesn't mean I will have it. I mean, that would just be wishful thinking. You might not have it, but you have to sort of check up. But external environment also matters in aging. Now, the type of the house that you actually stay in, whether it's on the ground floor, first floor. I mean, all the olden type of houses. I mean, in Bombay, when you say the olden type of houses don't have lifts because they were only 2-3 stories. So even if you're on the second floor, it's hell to actually get down and go and get up. So that can lead to a lot of isolation purely because you want to go down, but because the feet don't allow, because the knees don't allow, so you're not able to. Then the social milieu matters a lot, I think. Number of friends, what relationship with family, whether you have friendly neighbors, whether you're living alone, are you isolated, do you have a caregiver, do you need a caregiver? So the social history also matters. So as you must have understood that the aging is not, we always keep talking about in health, it's only about the disease part. It is not only the disease part, it is all the surrounding things with the disease that makes your aging good or bad.
So how we age and the environment and the activities and our lifestyle, all of this obviously play a role.
And just to add one more thing, which we talk a lot about, is stress as well. I mean, stress can be in various forms. It can be work stress. It can be, as we are seeing, people are getting more active. So a lot of older adults, they have had all their stress for their life. But suddenly they end up getting more stressed about their children. Then they end up getting stressed about their grandchildren. So
there's no end to worrying.
End to that. So that is also something which can be, because I have seen so many older adults who are anxious. They are happy with their life, but they're like, what will happen with my grandchild? I'm not very sure. So things like that. So then it becomes a bit more dicey. So there is no end to it. So one has to get that middle path wherein you are content with your life, but you also believe the latter generation that they will also take care of themselves and you are there if they need help.
Understand. So from your experience, obviously you would have seen a lot of older adults. What are the most common issues that people come to you with? What are the top problems faced by elders in India?
I think one of the most important things that various problems we see, if you talk, can be divided into various disease processes. So maybe if you talk about the brain, then of course dementia, cognitive impairment is quite common. Then mind, depression is much more common than we actually even think it is, because almost everything is put to the age. Like all older adults might get a bit dull in mind. No, that is
not get diagnosed also.
No, that is not the case at all. Depression is a disease. It is treatable. So one has to seek help for that. Then, of course, infections are very common, urinary tract infections and even in pulmonary infections, especially pneumonia. Now, pneumonias are very, very sort of important, and they have to be treated earlier. So, apart from that, I think electrolyte disorders like sodium getting reduced, then sometimes a lot of dehydration can also happen. Then the typical cardiometabolic diseases, which are there, diabetes is very common, hypertension is very common, heart disease is very common, strokes can be very common. Of course, dyslipidemia, which is the increase in the cholesterol. So that is also very common. Hypothyroidism is usually missed a lot. That is also something which is very, because they said that we don't feel anything, we have never got it tested, but in urine, routine testing almost every year when they do health checkups, they should do thyroid so that they actually know whether the thyroid is. Apart from that, there is something obviously known as geriatric syndromes. Two of them I already sort of uttered. One is depression and dementia. Then there is also something known as delirium. Now, delirium can be just an acute confusional state. So an older adult might just present with that can be a multitude of causes. I don't want to go into the causes of it. Then bed sores. I mean, bed sores would be when an older adult would be absolutely bedridden, dependent, and that is something I would never want, and neither with the older adult nor the caregiver, because this is not only about the older adult here. It's very difficult to care for them as well. Then urinary incontinence, again very easily branded to age. Oh no, baby, because I am old, that's why maybe I'm losing control. No, there are also causes. For example, prostate in males. In females, because the abdomen per se, the abdomen area just goes a lot of stress, whether it's pregnancies, whether it's surgeries. So it can get weaker. So a lot of older adults, especially women with coughing, sneezing, they actually lose control on urine as well. And so that is not supposed to be considered normal. Then, of course, malnutrition is also very common. I mean, when an older adult starts losing weight, rampantly losing muscle mass, we are very worried. So that is also something which we really closely look at. And so these are in overall the various multitude of problems. Falls, I think, are one of the very important things which have to be stopped or prevented rather than treated, because treatment of falls can be depending on whatever fracture has
Whatever
happened.
happens.
Maybe
Correct.
an injury to the head. I mean, it can be from something very near death to something which is absolutely morbid, in which a person might lose a lot of time. So I think falls are something which we should always try to prevent.
Always prevent. So a wide variety of problems and diseases. But let's say if we have to, since we are talking about well-being here, for a normal individual as one ages, or for the elders themselves, what's a realistic goal that we all should have when we talk about well-being at 60 and beyond? What's a realistic goal?
Yeah, so I think one obviously has to understand one's own body and one's own health. That is, I think, very, very important. And being healthy at 60, as I mentioned before, doesn't start at 60. It starts much before. So if it has not started in the 40s, it should have started in the 50s.
So when should one start planning for healthy aging?
I think, your healthy aging
Throughout the life.
Throughout the life, and that's why sensitization of older adults and aging should be done even in schools, colleges, and even working. So, for example, corporates are there. Now, in corporates, it shouldn't be that they are learning about aging because they have old parents or old grandparents. They should learn aging, as I said, for a selfish motive of themselves, that they have to age better. But when, for example, because of corporate, at least every yearly, maybe there is some kind of checkup which is happening, but not everybody is associated with corporate. So so people have to take that own initiative and try to do it. And it's always best to do it because we can see a lot of glaring deficiencies in even 30s, 40s. And we have to understand that as you get older, the earlier you detect, the better it is. So post 50, I would say almost all the screenings, especially for cancer, various cancers which are there, prostate, breast cancer. If you have a family history of breast cancer, you definitely have to sort of even sort of go earlier, because we generally screen all the females if there is any hereditary sort of pattern. Then there is another very important thing which sort of matters is, to age well, you have to have all the factors well. So, for example, when you are planning to retire, what is the post-retirement plan? It should not just dawn on you one day after the retirement, oh my God, I don't know what to do. So I think pre-retirement workshops, all those things also really help. They will also help in that case. And to prepare them is to obviously give them knowledge about the entire thing. And it should not only be about medical part. Of course, I think a lot of things happen in a lot of companies about financial sort of taking care of their own finance after 60, post-retirement, how they are going to do. But everybody should have some kind of plan, and they should be able to share it, that what do they exactly want to do post-retirement. So because a lot of people can go into isolation. And where they actually ultimately want to settle down, because their home is their home. I mean, children is okay, but their home is their home. If they want to be there, if they're comfortable there, then that is what would be the best. But sometimes it's not possible, purely because sometimes maybe one of the parents might actually die. And in that case, obviously, they don't want them to be alone, and they themselves don't want to be alone. So it becomes difficult for maintaining. I think communities also matter a lot, the way sort of you age. So I think your social friends, family, all, as if you are younger, if you get the networks more stronger, it will only help you as you go older.
I understand. So you specifically called out geriatric syndrome.
Yeah.
I said dementia and depression. Is it unavoidable in most cases? What actions can one take to prevent or significantly reduce the chances of geriatric syndrome? Is it just the social interaction that you just alluded to now, or is there something more? What action can I take?
I mean, to be very frank, for geriatric syndromes, all you have to take multitude of actions, including your physical. If you have disease processes, try to actually do a health checkup every year, and then let your doctor or if it's a geriatrician, then great, decide that how many times you need to do. For example, certain people have kidney diseases, so they have to sort of do it more frequently. Certain people have diabetes, so they have to do it more frequently. Things which should be always maintained: vision, hearing, and teeth, because all these three matter a lot for your quality of life. So the more independent you are, that's how you will be able to sort of avoid. Then constipation is another sort of issue. There could be gastritis. So all these things need to just be seen in a basic health checkup, which could be a mixture of maybe blood tests or whatever imaging tests, which the doctor would be the best person to tell you. And refrain of just taking packages blindly. Just try to get an idea on what you want to do from your doctor, because what happens is sometimes you just do things blindly and you are in a fix when anything comes positive. It has happened a lot. So that is another thing which I would want them to tell. Apart from that, whatever disease you already have, you keep that in control. I think that is in your hand. So that covers the physical part. Now, as far as the mental part is concerned, you have to keep yourself stimulated, keep your brain stimulated. If you say how will you prevent dementia, if you ask me that, yeah, definitely people will not, if people do this, then they won't get dementia. No, I can't say that. But the chances of getting to a cognitive impairment state, if you give yourself memory aids, like keep reminding yourself, maintain a diary, keep writing down what you want to do, then give your brain new tasks, maybe learn a new language, learn new skill. Gardening has been a lot of pros about it. And maybe community, for example, learning things in a community. Now, what COVID did is a lot of community sort of well-being went away because people could not meet together. So that social part was affected to a great extent. And and that usually can happen even when there is no pandemic sort of, because sometimes a person might not just have. So we have to identify people who are isolated, so that help or companionship can obviously be given to them. And another thing is empowerment, I think, of older adults. That will also help them in delaying at least the geriatric syndrome. Now, how do you empower? By making sure, see, they are the biggest human resources, to be very frank, which is not tapped world over. Yes, it's happening. India, I don't think that much of tapping is happening at all, because they have experience in life throughout. I'm not even talking about only work. So all those experiences can be bought. Volunteership is something which I really sort of recommend for older adults to give back. So then taking charge of people who are unwell. For example, fit older adults can be given the responsibility of taking care of unfit older adults. So that also becomes sort of a companion sort of a thing in which the control is still with older adults. It's not. Then, of course, intergenerational also helps. I mean, one of the best bonds anybody has is with their grandparents. So that helps. But it doesn't need to be only in a family situation. It can be, an older adult also can get younger friends. So it's not that they cannot. There is
They
no
have
age
to
for
only have
friendship.
it in their age
Yeah,
group.
and there is no age for learning also. I think learning is one of the very important things that everybody should do. And if you don't get a disease for the maximum amount of time, then yes, you are reducing the chance of getting any kind of geriatric syndromes. But if you get it, seek help. I think that is one of the very important things, especially in mental health. Physically, if you get something, you are in urgency and you want to sort of get through it. For example, if you get a chest pain, you yourself start thinking, oh my God, is it a heart attack?
Correct.
But if you are feeling low for days together, and you don't really sort of think, no, I should visit the geriatrician, I should visit the psychologist or the psychiatrist and express myself. It's not necessary you have to visit a doctor immediately, but express yourself, whether it's in a form of a diary, whether you want to sort of talk to anybody that you trust. It could be your spouse, it could be your child, it could be a stranger who's not in your family, but so that you are actually able to get out of it. So there is one thing knowing about your diseases, there is another thing seeking help. Because a lot of times older people tend to delay, and not real reason, because sometimes there's just denial that no, I am very fit for so many years, I didn't get anything, why will I get things? So that delays, and then the delay might actually not help, and the chance of getting the geriatric syndromes becomes even more important. So specifically, if you say falls, then there are a lot of things one has to do, depending upon how physically active you are. The more physically inactive, more bedridden you are, the more dependent you are, then there's a chance of greater amount of falls. So what things can be done for fall prevention? Of course, things like flooring, things like carpets, too much of clutter, all those things also can be avoided at home. These are very small things, but for an older adult, this can actually change the complexion of them actually having a phone.
One of the other diseases that get talked about during for elderly is the Parkinson disease.
Yeah.
Is that again something that you call as part of geriatric syndrome, or is it influenced or caused by something that we can potentially prevent?
Actually, Parkinson's would not be specifically known only as a geriatric syndrome, but yeah, it is very common in older people, and it's one of the degenerative diseases. So the problem with degenerative diseases is you can't completely change because the brain degeneration obviously happens in Parkinson's to a great degree. But what you can obviously do, there is medication. Controlling the disease is very important with physiotherapy and with obviously sort of balance exercises to make them more active. That is, I think, which is very, very, very important. And there are a lot of groups also for specifically for Parkinson's that work. So yeah, Parkinson's, if you see in specificity, it can be a really debilitating disease. But again, diagnosing it at an earlier tilt will obviously help us in helping those people, because a lot of times people with Parkinson's can later on get dementia as well. So then that becomes even more difficult. A person who is so rigid and not even understanding, actually not even having memory, not being able to interact, that becomes even more difficult to handle.
So to summarize what I got is, keep a close watch. One is, from the point of keeping a regular tab on yourself in terms of getting the medical checkups done, writing it down in terms of the changes that you notice, take some tasks in terms of learning or gardening or any community activities, and just make sure that your vision, hearing, and teeth are under control. And one of the points that you mentioned was, if you have some additional other diseases already, then the chances of you getting geriatric syndrome is higher. So specifically, let's say you have a family history. I think you talked about that. Let's say you have a diabetic parent or some family history of other common diseases. Is there anything specifically that we should do in such cases apart from these general tips that you gave?
No, I think screening of your health has to be done. For example, if there's a history of diabetes in your family, then you obviously have to keep checking yourself. But not only checking is enough. I mean, you have to have a healthy diet. I'm not saying if you don't have diabetes, you don't need to go into diabetic diet. But if you a healthy diet, exercise, lifestyle will always, in fact, all the three together always delay the chances of stroke, heart disease, diabetes, even cholesterol. Drugs actually work the last, to be very frank. Drugs are a subsidiary. So for example, if you give drugs to reduce cholesterol, that is not the only thing which is reducing. With that, you have to have a good exercise regimen. You have to eat good diet. So it's everything taken together. And what I would like to put in a nutshell is, however active you are, to continue that, you have to make sure that medically you are sort of fit. More the health is disturbed, more you will go into dependence. There are a lot of times people get dependent for some time and they come back to their base. So for example, if somebody gets an infection, they are admitted, or if somebody has a fall, or maybe if somebody has a surgery, major surgery, cardiac surgery, they come back and they come back to their original level. But a lot of people who have multiple diseases already might not come back to the original level after an admission also. So then that can be termed as frail. So when a frail older person gets a lot of diseases, they might not return to the baseline, and there's a chance that they might get more things in future also. So I think that is very, very important to try to maintain the baseline. Of course, if you improve on your health, that is very, very good, but never lose the baseline, because a lot of times you have seen older adults, once that happens, then it becomes a bit of a downward trend.
So you should avoid getting into the downwards.
Yeah.
Moving on to look at this from a caregiver perspective, Dr. Prem. We get a lot of attention and care as children. For the parents, children never grow. But at some point, the role reversal happens. I would like to get your perspective on when should someone start looking at himself or herself as caregiver? And where and how do we begin in that journey?
Yes, I think as far as the care of any person is concerned, I think, I mean, especially health-wise, the caregiver plays a very important role. In older adults, absolutely even more so, because when we work in a, sometimes old elder care can be a multidisciplinary kind of thing, in which the caregiver and the older person is also the part of the team, because without them, nothing happens. Their wills, their ways of accepting treatment also matter. So if you say the term caregiving per se itself, if you break it down, it's not necessarily it has to be a family member, because a primary caregiver could be a family member. Yes, it could be the spouse, it could be your child, it could be your daughter-in-law, it could be your brother, sister, depending upon your family sort of circumstances and family structure. But we are also now in the age, and it's been happening from a long time, but now more and more talk about is that there are professional caregivers.
Correct.
So caregivers who are substituting for the care you wanted to give, but they are better than you in that because they're trained. It's not that you are not able to sort of. So I would say in general, taking care is always there. I mean, whether we knowingly, unknowingly, knowingly, we sometimes cross also by taking over care. For example, a lot of times older adults are like, I mean, they don't even allow me to go out. I'm okay. I want to go out, but they're not allowing because maybe there was a near fall and so things like that. But with discussions with the caregiver and with the patient, these things obviously can be sort of sorted out, and it's all about confidence. I think the older adult has to be confident, but the confidence of the caregivers also matters. Now things change when the older adult is more ill. Now, when, for example, if the older adult has dementia, now caring for a dementia person is not easy.
Absolutely.
And only one person caring for that, of course, depending on the stage of dementia, but whatever the stage, is very, very difficult. And it only gets more difficult if it's a progressive disease. Sometimes it goes into a plateau, but it can be a progress. For example, if somebody has Alzheimer's, it can really progress. If there is a behavioral component, there could be restlessness, there could be aggressiveness. So then it becomes, so it takes time for the caregiver to actually even realize, no, that's not, to still remember that it's the disease. And it's not the parent who has changed. It's the disease that has changed the person. There is still that person behind that. And that is very important. That's what we keep telling people, not to forget that. Even as healthcare people, not to forget that it's the disease we are treating. The person is still there, and that respect and dignity should always be there. But it can become very, very difficult. So that's why don't do everything yourself. You have to have some kind of respite. Make sure that whether it's family members, whether it's friends, or if not, then of course professional caregivers who can take that responsibility, because a lot of times the caregiver might be also the financial breadwinner, and it is very common. So that will be difficult. And of course, it could be a spouse who's old themselves, so they might have multiple diseases, so it's not very easy for them to take. They might not be able to take care of themselves, so how will they take care of the older adult? So that's why I think caregiving in India in general is always supposed to be an understood thing. Family will be sort of taking care. But that's not the way it is. There is a lot of professional services. And I think that should also be looked onto, purely because or else it will become very difficult for that caregiver to actually devote all the time. And that is where guilt comes in. Oh, I'm not able to do enough. And then that goes into them not taking care of themselves, then caregiver stress, then the caregiver might be into depression. That's why we always say you have to take care of the caregiver as well. So the caregiver has to take care of themselves to give better care to their older adults. So that is something which is very, very important.
So caregiving can be stressful, and you're suggesting that so where possible, do take help of professional caregivers. And you also mentioned that don't restrain the elders too much. Allow them that space, right?
Yeah, and both ways.
Yeah, both ways.
It works both ways. So, for example, even it's always said 2 steps from either side, and the meeting should be in between, because or else there won't be any meeting. Then another very important thing, just to add to that, caregiver, is take care of your health, or else you will break down.
Absolutely.
And the day you break down, you are just going to not be able to take care of yourself, let alone take care of the older adult or whoever is ill.
One of the questions that we often grapple with is how do we distinguish between a condition where we can say, hey, this is normal aging, so no need to worry, give them their space, etc. Or this is something that needs medical attention. How do we differentiate between the two from a caregiver perspective?
Yeah, so I think knowledge always helps. So for example, if I have to go dementia again, the biggest thing that as a healthcare provider we want to do is to make sure that they are educated enough to understand the disease. If they understand the disease, then only they will be able to care better. Or else it will just be, oh, they are just, he's just behaving or she's just behaving very absurdly. I'm not even understanding what is the problem. This is all because of age. But that's a very general statement. It could actually be a disease process. Now, a lot of, for example, if somebody has to lose their memory, it could be happening very normally. So a lot of older adults are like, oh my God, I'm going to get Alzheimer's. No, that is not the case. But things come back to this. So for example, somebody's name they forgot, or maybe some number, but after an hour, oh yeah, I saw him, I remember. But in case of Alzheimer's and dementias, there is no coming back because there is no flow, obviously, sort of even established that that person was being seen. And so same can happen with direction. So everybody here and there loses
Once
direction.
in a while it happens for all of us.
An older person with dementia will not have any clue. So that's why we always tell them that they shouldn't be allowing. There is something known as wandering. So sometimes they might just wander out, and a lot of older adults have been discovered. And luckily, more and more people are putting those badges, those things on the hand, wherein the address is there and the phone number is there. So at least if somebody gets lost, then they are good. But because they are not understanding, they just went, they are inquisitive, they are just trying to go around, but they are not understanding where they actually are. Now, another thing is, of course, this is more in pertaining to memory. But apart from that, to differentiate disease and this, the myths have to be sort of busted. Now, not all older adults will get depressed. Not all older adults will have sort of dementia. Not all older adults. See, there is a general tendency to think they cannot learn after an age. No, nothing like that. Learning doesn't change. Maybe the pace of learning will. But that doesn't mean that they cannot learn. Now, for example, if I have to quote that there was a task given for PowerPoint. So an older adult also was given, the younger person was also given. So the older adult did a PowerPoint presentation saying, this is what I did, this and all. And he discovered things that the younger adult also had not seen. Because whatever they will do, it might take more time, but they are elaborate about it. Whereas I think when we are much younger, we are about the task. No, the task has to be finished. It has to be finished. The time.
You want to move on to the next one.
Yeah. So that we can move on to the next one. So I think that is also very, very important. It's important for you to recognize the red flags. So I think the red flags matter a lot. So for example, if somebody is again and again forgetting, and you are seeing they are not realizing, then especially in depression, there are a lot of red flags. A normal person who keeps talking with everybody suddenly is just completely shut down, not wanting to go, not wanting to meet people. Whenever people meet, there is a bit of irritation, or there is no opening up at all. So if there is a glaring sort of change, then of course disease processes have their sort of way of coming, especially whether it's diabetes, whether it's of course hypothyroidism. They have specific symptoms which of course the caregivers might have to sort of understand. But everything sort of joins when you actually have regular health checkups. I'm coming back to that is why, because you know your knowledge, yes, and Google doesn't help. I mean, let me just very, very frankly tell, because when somebody types something in Google, it's not necessarily the best result that comes. It's the most seen result. So, and that is not necessarily the most knowledgeable. So I would say, do not blindly believe in that. Justify or clarify those things with the doctor or your healthcare provider before doing anything. And we are here to sort of this is particularly I'm saying from the caregiver point of view, because a lot of times the mind is already cluttered before coming to even meet the doctor. It's like, oh my God, it could be this, it could be that. So for example, if you put headache, the causes of headache will be multitude. It can be from anything from a normal headache because of lack of sleep to a tumor in the brain. So if you're putting so much of knowledge in your mind, then so that's why I would say clarification is very important. Don't blindly believe. There is no use of being a Google doctor. So I think that is something, especially from a caregiver's point of view, justify or clarify things. It is better rather than just believing, no, it could be this also, could be, because you might end up putting more tension even for the older adult. Even they'll start thinking, oh my God, this is what is happening with me. And once their confidence goes, then it becomes difficult to get them out of it.
Understand. So from a caregiver point of view, you mentioned look for red flags, look for glaring change in the normal behavior, and any repeated pattern is what should kind of get your antenna up. And again, you mentioned that for us to recognize whether there's something that is of concern or not, you need to have some knowledge. And therefore, looks like, regardless of where you are in your journey of preparing for your elder years, or in your journey as caregiver, awareness is very, very important. And therefore, that is a key takeaway that I have.
And multiple doctors and multiple, even geriatricians throughout, whoever they are giving that awareness. So just try to be a part of those so that you can obviously increase your knowledge. The reason I'm saying is I'm not telling you to study the disease completely, because it's not. You are not the doctor.
Correct.
So, or else it's just too much of information overload for yourself.
Just at least you should know what symptoms to look out for. What are the red flags that you need to look out for?
Yeah, and that usually is always done in sensitization talks, health talks, and even if you ask the doctor, they also sort of help out for sure. Then medications, I think, is very important, which we didn't touch on before. I think knowing the medications for an older adult themselves is most important, because a lot of times it's just the caregiver who might be giving, or they usually say they just keep it in the pill box, or they look at the size or the color. So they might not even know. So I usually tell all the older adults, at least they should know the names, because whatever said and done, they are chemicals that they are taking. So they should understand and is there for their body and health. If they are not, of course, able to do it for whatever reason, sometimes vision could be a problem. Sometimes dexterity is the problem. They might not be able to open things themselves. Then seeing what the medication is there, dose is there, because it's usually all very small. So it becomes. I know people who actually use magnifying glasses also. So people do that also. It's not that they don't. Older adults find ways to actually still adapt. So that's another thing I want to mention. Adaptability is very high in older adults. That is the reason they have lived to that age. Let us be very frank about it. Then medications are something also, don't blindly sort of take anything and everything. A lot of times I have seen people not talking about the other medications, especially the Ayurvedic or the homeopathic medications, and then they are like, but they are just additive medicines. So I am like, no, whatever you're taking, you should tell. And because when we talk about medications, it's all. And over the counter, unfortunately, a lot of older adults, they might just go to the chemist, and sometimes they get it. So that is something, of course, more and more is reducing. So that also can be a bit of an issue. So medications, awareness of side effects. Whenever a medication starts, usually all doctors explain this could be there. But of course, if you have any doubts or if something happens, then you obviously should be asking.
Understand. There's one question from the audience here. This talks about when the caregiver is a spouse, there is a lot of emotional impact, emotional upheaval, seeing your partner in that state. Are there any specific inputs perspective that you can give for a spouse who's a caregiver?
Yeah, so specifically, of course, I would say, one, you should take care of your health. By health, I don't mean only the physical part. You should be taking care of your mental health as well. By that, it could be anything. It could be meditation, it could be music, it could be not talking, it could be just staying in a dark room for 20 minutes or a lighted dark room, staying in the open. But you should still have your time, because if you don't have that time, then you are not able to sort of energize yourself. And this is a very common thing. A lot of spouses either way are taking care of whether their wife or husband, and it's happening very commonly as well. Please know, if you can get help, you should realize that you should be taking that help rather than just doing everything yourself, because you will ultimately break down. but try to still keep doing. I know a lot of people who still do their own thing. They are caregivers, but they still make sure that they have their own time, because ultimately, if your health, I mean, I have to reiterate, if your health gets affected, you are not being able to take care of two people. It's yourself also, and it's that older adult as well.
Correct.
And try to take breaks. If it's a continuous care, for example, if it's a dementia of a person with dementia, then there is another thing that caregivers nowadays have started even accepting and doing also. There are assisted living homes as well, who properly take care of older adults, whatever the disease process. For dementia specifically, there are multiple which are come in India. They have been there for years abroad. I mean, it's not that they have not been.
Correct.
Of course, they might come at a price. For example, because assisted living is not an easy thing to sort of provide as well. But they know their stuff. They will do a good job. So if you're not able to take care, why I'm mentioning it, there should not be any guilt in you. Oh no, I just sort of send away, because there are a lot of people around you who might make you feel guilty. That's very common. It's like, oh, you send off your husband away. That has also happened. I mean, or you send off your father away. But that's not the case. Then another point which is happening very commonly now is there are a lot of elder communities. So people themselves are deciding that what will I do with this 5-bed, 6-bed, huge room all. I am only there and my wife is there, children are all settled elsewhere, and one person has to come and clean everything. So they give it off for rent and they go and stay in communities. So for example, in Coimbatore, there is Nana Nani. In Pune also there is, I'm not remembering the name, but there is. And there are a lot of elder communities. So they are older people who themselves have decided to go there. So it's not that, oh, the children have told they are not going to be living. No, so they have decided. So that is also coming up. And that also helps their independence, because they are able to take care of themselves, make new friends of that age group, younger age group, and also try to make sure that they are doing more things. And in here also, they can be a part of the society. For example, there is a society president, society this. So everybody is old at the same time, they are doing something more. So there are various ways of taking care of older people for themselves as well. It's the choice that they have to sort of take.
Understand. Okay. So the key takeaway here is caretaker has to first take care of himself or herself, and then the other, and don't be shy to take external help.
Yeah, to be very frank, simultaneously, I would say, because a lot of times you don't get that thing, okay, I will take care of myself first and then I'll do. So simultaneously, but don't forget yourself, because a common thing that happens is you forget yourself.
Okay, coming back to the family itself, you did talk about intergenerational bonding and so on. What can grandchildren and children do to make elders feel better and more relevant?
To be very frank, if they are there in the same room itself, that is enough for grandparents. I mean,
they'll just watch and feel connected.
And of course, when they grow older, a lot of interaction happens. It's both sides. It's like from here, it's all the modern thing. Oh, this is happening in this is happening there. And from here, oh, at our times, all those great stories of their childhood. So there's a lot of information exchange, which also sort of happens. And I think that is something the grandchildren should really do whenever possible. See, it's not always possible. And to be very frank, it's not anybody's fault. Because ultimately what happens is, as parents, you want your children to get better. So if there are no opportunities in the same state or at the same place, obviously people go outside. But ultimately you are providing that platform to them. And you obviously want them to be successful. So not always grandchildren can also spend that time. But if they are living together, yes, of course, that is great. If not, whenever you do visit them, you should sort of spend a lot of time, because they just love it. Let me be very frank. And it also stimulates their brain to a great extent. Emotionally also, they will be more stable. Another thing which is there is, when they have doubts, older adults, just don't solve it. Help them to solve it. True. For example, if there is something to be ordered online, yeah, you can do it. I know you would want to do it rather than explain the app, say that this is, but then once you explain it to the older adult, they will be able to do it. So I would say that is another skill you are actually providing them. Remember that. So that's a learning. So something that you can do, and if you can impart that, then that also really helps in intergenerational bonding. Then it has also been seen people with dementia. I mean, this was sort of, you can call it an experiment also. It was done where people with dementia were there with a nursery. And people who were actually being very sort of agitated, restless, when they saw children, very all that, they were really sort of at peace and this. So that also has been done. Intergenerational bonding really has a huge role. And it should not, again, it should not only be their family, it can be there anywhere. I mean, an older adult goes in the park, it could be a person who is playing their game, coming back, chatting. So that is also an intergenerational bonding which should be taken forward. It should not only be in the family milieu, it can be in the general cultural milieu.
Absolutely. Okay, so I think a couple of last points. What, in your opinion, is the biggest challenge we face in India today, for ensuring the well-being of maximum number of elderly, right? Is it awareness? We did talk about awareness. Is it infrastructure? Is it involvement of other stakeholders, industry, government, corporates? What are the challenges from your perspective that we need to be aware of beyond the family that we discussed?
I think it's a bit of all. The reason I'm saying is elder care can be as easy to do and as complicated. The reason being, it should never be done alone. It is something which you should have multitude of partners, and partners will be in government, private. Government policies matter a lot. Then private players matter a lot, because things like assisted living, all those things have come in the private setup. Communities, elder care communities have come. Getting jobs for older people.
Yeah.
So a lot of private and public sector both can play a sort of an important role in that. So what I would say is challenges have been multiple, but it has to be a joint responsibility of course, the government, corporates, the stakeholders include health and non-health both. Human resource is one of the very important things. Now, you can keep, like the first statement you said that so many older people are there, but where are the people to take care for them?
Correct.
In all ways, I'm not talking about caretaking. Health-wise, how many geriatricians do we have? And how many sort of caretakers, caregivers, professional who understand elder care? So that's
by the way, how many geriatricians do we have?
We have plenty. We have much more than what maybe would have been there 20 years ago. But it is building up. It is a branch which is building up, and it will build up. It will build up even more, because there is a necessity. So human resource development is very important. So train more people, and training means skill training, wherein they can actually understand what is older people, how they have to, whether it's for counseling them, whether it's for companionship, whether it's for their health, whether it's for their physical, mental health, or whether it is purely for other things which might make them better. Like, for example, provision of jobs, helping them to volunteer. So there are a lot of organizations who are looking for older adults as volunteers as well. Then try to make sure that they are more connected socially. And I think maybe this joint thing, if you remember the movie The Intern, so in that it was quite a bit of a joint sort of, it was a young person with an old person. So the experience came in, and then of course the developing sort of technology came in, and they could work together. So I think more of that would happen, whether it could be short term also, that would really help. Now, one has to, and there has to be an organized sort of setup in this. It cannot just be that, okay, we know older people are increasing, we know we need more people, so let us sort of get into that. But and even to a great extent, insurance also. I mean, a lot of lacunae might happen when older adults might not get insurance for certain disease processes as well. I mean, mental health is still fighting that battle, in which whether it can be insured or not. I mean, there is a lot of talk happen. I think mental health has been taken up so much because of COVID. So that is another thing which is very good. And geriatric mental health even matters even more. So I think it's various stakeholders who need to come together, and I think it has happened as well. Even a lot of startups in the last 2 years have really put their heads together in trying to see how different types of older people can be approached. It's not only the hospital, or it's not only the home, or it's not only the community. Even the bedridden person, through AI, through technology, people have been able to reach. So I think that it's only going to be something which will help us in taking care of them better. But I think a sustained organized teamwork is what would be needed for, often it is saying there is going to be a tsunami, silver tsunami very soon.
Yes.
It's already happening.
Yes.
But I think we are much better placed maybe before the pandemic than we are now. Because before the
Absolutely.
pandemic, we were not as better placed, because I don't think we had sort of changed our outlook of thinking of elder care. But during the pandemic, because people, for whatever reason, got more time, so they were obviously able to see what lacuna are there. And then in a joint way of working, I'm sure that we will be able to provide better care. A lot of people are doing very good work individually. What would happen is, the best thing would
We
be
have
if
to
everybody
make
can
it
come together and
Sure.
obviously complement each other.
Correct. An ecosystem has
Yeah,
to develop to
that is
kind
the
of
word. The ecosystem will be strong only if all the components come together.
come together. So, yeah, I think very relevant points. And, as I completely agree that multiple stakeholders would have to come together to ensure the well-being of elderly. And you mentioned the point about utilizing the skills and experience of elders. And in fact, you also mentioned pandemic, and pandemic has also demonstrated that elderly can be very adaptable.
Absolutely.
They have now easily taken on to Zoom calls and participating
and
in.
in fact, they are saying, okay, now my Zoom call is going to start now. So let me I have to get into
Yeah,
it. So
I've heard multiple, one after the other. They're quite busy.
yeah, and it's really and they have been able to substitute that community feeling in the Zoom call as well. Of course, if you ask me, everybody would want to meet in person. There is no doubt. But at least there was a choice, or there is now a permanent choice for future, where if you want to attend something which you might be missing, you still can attend it online if you're not able to. I mean, in fact, we were able to sort of get in touch with people. Older people could get in touch with people throughout the world. So that also sort of changed. That is one thing. Second is, people who had no idea about mobile phones, they used to use only normal phones which have incoming, outgoing message. They actually learned phones in such a great way, which showed us. I mean that is the biggest lesson, as you're saying, adaptability.
True.
They showed us again that we can be adapting to any situation and sort of overcome it.
Absolutely. So well-being at old age is a factor of multiple things. How one has lived their life, till the point, and how they can still manage. We keep talking about adaptability, and multiple factors can influence the emotional health, the environment, the social interaction. We didn't talk about financial health, but last time we did talk about that. Any and all of this can have a significant impact on the overall well-being of the elders. It's been a fabulous session. You've touched upon a lot of points, a lot of thought for us to kind of think through and adapt and make sure that we put in place as we move forward in our journey to be an elder or to be a better caregiver. Thank you so much, Dr. Prem. It's been a pleasure.
Yeah,
Thanks.
thanks.